ideal indications for a uni. Let's talk about body weight and osteotomy versus uni. Taylor, what do you care about BMI?
I don't. I think there's a lot of heavier patients who develop arthritis and they still do great with osteotomy. The alignment correction is powerful.
Arun, what about a uni? Do you care?
For mobile bearing unis, there's really no evidence that BMI matters. But I think common sense
You believe everything you
dictates,
read from Oxford?
most of it, but I tailor it to our patients' condition, and most of them, if some of them have significant osteomalacia, osteoporosis, they're short, then I might rethink doing a uni. But otherwise, I'm not terribly concerned.
Anoop, what about body weight?
Yeah, so some of these patients, apart from body weight, have metabolic syndrome. And metabolic syndrome leads to progressive arthritis.